If you're struggling with agoraphobia, then I invite you to go to my website and learn more about the online treatment that I provide for agoraphobia via Skype. So, agoraphobia is a condition that often keeps a person homebound, making it very difficult to go and get the help that you need from a therapist because it's difficult to leave home. So having access to an online therapist for treatment is very essential in many cases. So online treatment works best when you use Skype or a similar video platform. You need to see each other. You don't need to be in the same room, but you do need to see each other for psychotherapy to be effective. And we want the best possible therapy to help you overcome your agoraphobia. So if you're looking for online treatment for agoraphobia, then please feel free to contact me and ask any questions that you may have, and tell me more about your own particular situation and also what you've tried so far. So I offer mindfulness therapy, and specifically mindfulness-based exposure therapy as the treatment for agoraphobia. The primary concept behind mindfulness-based treatment is that you work on completely changing the relationship that you have to your anxiety and to the reactive, habitual thoughts that feed that anxiety. The main problem that stops people recovering from anxiety is that they become completely identified with the anxiety and with the accompanying reactive thoughts that feed that anxiety. This has the effect of continually feeding that anxiety and preventing it from resolving and healing. So in the mindfulness-based treatment for anxiety, we learn how to change our relationship to our anxiety, where we do not become identified with that anxiety. Instead, we learn to observe it. We stay as the observer, and we cultivate that state of awareness as the observer that sees the object, which is the anxiety. So we turn the emotion into an object. This is crucial. If you can do that effectively, you will take away the fuel that keeps that anxiety alive. And if you stop feeding the anxiety, then that anxiety will automatically start on a process of resolution, of healing. It's the reactivity that's the problem. The reactivity inhibits healing. So mindfulness is learning how to overcome reactivity in general, how to stay completely present with your emotions, with your anxiety, with your thoughts, without becoming reactive, without becoming identified with them, and without blindly falling into the trap of propagating more thoughts and more emotional reactions to that anxiety. The method that we use to do this is called mindfulness meditation. The way that I teach it is quite different than is presented in the popular media. Mindfulness meditation for me means meditating on the mind. It means learning to be present with your anxiety and your reactive thoughts, instead of becoming blindly identified with them. So we meditate on our anxiety. We meditate on those difficult reactive thoughts. We train with them in order to gain freedom from them. You cannot expect to get free if you just ignore those reactive habits. Anxiety is a habit. It's based on a series of conditioned habitual reactions. We need to make those conscious so that we can re-establish balance and re-establish control and re-establish perspective and basically develop freedom. But you cannot develop freedom by ignoring the mind. You have to develop freedom in relationship to the mind. That's the fundamental difference here. So mindfulness meditation is the means by which you establish freedom from the mind. Now, mindfulness-based exposure therapy is the process whereby you systematically work through those challenging situations, whatever it might be, whether it's walking around the neighborhood or driving a car or going into a public place like a cinema or a shop, whatever it might be. We turn these into challenges and we work through them systematically. Again, the key is not to avoid them. Avoidance is the biggest trap in agoraphobia. People fall into the trap of trying to avoid anxiety-producing situations. And all that does is feed that underlying fear. Avoidance is a form of fear. It's another reaction to the anxiety, a fear-based reaction. So our path is one of non-avoidance. So we design a series of challenges, and then we take each challenge and we train before we do the challenge. We train with it by meditating on that challenge. We play it through in the mind. We learn to be the observer, watching that particular scene of going into a shop or walking down the street or whatever it might be. We look for the specific reactive processes that get triggered when we imagine doing the challenge. We look for the anxiety reactions. We look for the reactive thoughts. And when we see those, we then start working on changing our relationship to those habitual reactions. We learn, in fact, to welcome the emotions and to welcome the thoughts. We become the host, and they are seen as visitors, which is actually a much more accurate way of describing the mind and how it works. Anxiety arrives in the mind rather like a visitor. It exists for a while and then it goes away. It may return again, but it arises and exists for a while and then resolves itself. It has a life cycle. So our job as meditators is to train with that emotion so that we maintain our objective perspective as our true self, the observer. That is essential. Now we're beginning to break the blind, unconscious habits that feed the anxiety. And when you stop feeding it, it will start a process of change and a process of healing. We can also help it heal by bringing in the element of compassion. This is really taking that consciousness to a higher level. If we can be compassionate towards our anxiety, we are certainly developing a higher level of consciousness. And that makes us much more free from identification with the emotion. So compassion is a very powerful and important part of the healing process. So mindfulness is developing consciousness and compassion for those emotions that are in pain. Those emotions need our help to heal. And that help is provided by mindfulness. There are lots of different aspects of mindfulness therapy that I'll teach you during our Skype therapy sessions together, but that's a taste of the approach, and it's very, very effective. So we train before we do each challenge. We play through the challenge in our mind until we have completely neutralized those habitual anxiety producing reactions. Then is the time to do the challenge, and that will then reinforce our training. After a suitable break, we might repeat that same challenge again. That's fine. You can do it as many times as you need to do until you feel completely free from anxiety. Then you move on to the next challenge on your list of exposure challenges, and you work through that in the same way. You train first through mindfulness meditation on that challenge. You then do the challenge, and you repeat the challenge, and you keep cycling through until you have neutralized all of the anxiety reactions. And so you move through your list of challenges, and each time you gain considerably more confidence quite naturally. In fact, that rate of growth in confidence and the rate of decrease in anxiety will tend to increase exponentially as you do each of these challenges. It's not a linear process. Confidence building gains momentum quite naturally after 3 or 4 exposure challenges. When you've done that well and thoroughly, you'll find that your confidence to do the next challenge will be at a much higher level, and the rate of healing increases each time. So mindfulness-based exposure therapy is a very strategic approach that has proven to work over and over again. Most people see dramatic changes within a matter of a couple of weeks. The secret is learning how to meditate on your anxiety, how to do these exposure challenges, and then being sure that you do it consistently every day to build that strength and confidence. As with all processes that involve habits, it's training that makes the difference. Conscious, deliberate training. And that's the focus of mindfulness-based exposure therapy. It's a very good treatment for agoraphobia. So if you'd like to learn more and you'd like to schedule a Skype therapy session with me to get started on your treatment plan for overcoming agoraphobia, then please email me and let's get started. Thank you.